Hello everyone. I'm sorry it's not Wellness Wednesday. I was not feeling well actually last Wednesday. I was homesick. So we've moved our OIC spotlight from last Wednesday to today. It's Tuesday. It's terrific, titillating Tuesday. I don't know. We're rolling with it. So I'm Jonna. I'm a therapist here at Omaha Integrative Care, and I'm joined today by our wonderful medical team. So I'm going to have all of you introduce yourselves and your role here at OIC.
Okay,
I'll start with you.
Okay, I'm Emily Fischer, and I'm a nurse practitioner here.
I'm Mueller, and I'm a medical assistant.
I'm Tracy Astorino, and I'm a medical assistant as well.
Awesome. So if you are already a patient here at OIC, you may have met one of these three lovely women. And if you haven't, you should come in. You should meet them. You should work with them. They're awesome. So Emily is our primary care provider. She works with our patients who are seeking primary care. And it's really cool because we're an integrative clinic, right? So it's a little different. So can you talk a little bit about how it's different than maybe at a traditional medical facility?
Yeah, well, the care that we provide here, we're really trying to incorporate body, mind, and soul. And Tracy forgot to mention that she's also a yoga instructor here as well.
Yes.
So, of course, being in a yoga studio, having our wonderful therapists and having psychiatric nurse practitioners, massage therapists, body workers, we have so many different modalities for healing. And so we have much wider variety of options when it comes to treatment.
Yeah. So we all, as you can tell, we all work together at this clinic. We have lots of different areas and expertise, and we all work as a team. And so I'm a therapist, right? And so I might have a patient that I'm working with, and I say, you know, I'm wondering, I'm hearing you mentioning some of these symptoms. Maybe if you work with Emily, you can work on that with her, or maybe you can go to a yoga class with Tracy and get some benefit there as well. So that's a really lovely thing in that we've got it all in the same place, and we all talk to each other. So it's really cool. We love it here. So can you talk a little bit about maybe your favorite kind of patients to work with, or different issues that are kind of your passion?
Mm-hmm. Yeah. So I have most of my background is in women's health, and so I really like to work with hormonal conditions like PCOS. I like to do preconception planning, postpartum care, and we can of course offer well woman exams here. You can't see, but we have an exam table right here. I love to do preventative visits, so wellness exams, sports physicals, school physicals. We see teenagers as well as adults, so that's great. What am I missing? Can you think of anything?
No, I mean, I think this is the integrative model, though, is being able to bring everything together. And really, Emily, you like to focus on actually our nutrition as well. Mm-hmm. What are we taking in? You know, how are we treating our bodies? And are we taking care of ourselves? Are we getting enough sleep? Mm-hmm. So there's many different parts to being well. And actually today, after this, I'll be doing my physical with Emily for the first time, switching. So I'm super excited about that. If that doesn't speak to you, nothing does. Because I truly believe in my wellness. It's really, really what I promote. So entrusting her and knowing the practice or knowing the care that she gives our patients, I want to be a part of that. So, yeah.
Mine's in a few weeks.
Yes, I love that. So from your perspectives, what is different about coming here for medical care than maybe if you've worked in other settings, or if you've been a patient in other settings?
Yeah. So I think, like we were talking about a little bit ago, this is a very small practice. And usually, if you need something, you're going to get a hold of myself or Emma. And then we have direct contact, obviously, with Emily. But it's really, really inclusive, right? So we're all working together. We know you when you call. You know us. And I don't know, I think it just feels really good to know who you're speaking with and know who's getting you your care. So, yeah.
Those relationships are really at the core of the work.
Mm-hmm.
Yeah. And how about from your perspective?
And previous jobs that I've had, this just feels a little more, just you're given special attention. Your time with us is one-on-one, and we get to know the patient really well and just give the best care.
Mm.
Yeah. Mm-hmm. Yeah, and we're fortunate because our intake visits are usually 60 minutes, and then follow-ups are between 30 to 60 minutes. So there's less pressure and less rushing.
Well, thank you all so much for taking time to be on video with me today. Is there anything else that you want to make sure our community knows about our services? Oh, I totally forgot. Can you talk a little bit about, this is my fault. I totally forgot. I wanted to ask about our collaborative care. Yeah. Oh, you've got the flyer. Wonderful.
Go ahead.
Okay. So we recently started a new program called Collaborative Care Management, and essentially we have one of our wonderful yoga instructor / therapist employees. She is joined us as a care coach, and so there's multiple different realms that she's going to be helping people. She has, of course, the somatic approaches from doing yoga and body work, breath work, mindfulness. She has social approaches, so she has a lot of great experience helping people connect to like community resources, food banks, even like legal things as well. And then behavioral health approaches, nutrition, how to build routines and habits for overall healthy lifestyle, time management, and even some budgeting help. And then it's not a substitute for therapy, it's an addition to therapy, but she also has some cognitive approaches. So some cognitive behavioral coaching, self-compassion work, problem-solving coaching. So she's essentially another team member to add, and I'm sure there's gonna be more coaches coming on. But right now we just have one.
Yeah. But this is just bringing together, like if you're seeing a therapist here or getting your med management, and then bringing you here with the medical portion of that. So we're all working together as a team to take the best care of you, honestly.
And it's usually covered by insurance.
Yes.
As far as I understand, so it's not usually an out-of-pocket expense.
Absolutely. Yeah.
Which is great.
That's great. Awesome. Okay. Well, thank you all so much. Is there anything else that you want to add or say to our viewers out there?
Come see us.
Yeah, come see us. Absolutely. All right. Well, thanks for watching. Stay tuned. Next week we'll have our overview of what's coming up next month. Thank you. Bye.
Bye. Happy Tuesday.
Happy Tuesday.
I forgot we were going to talk about that.
Happy